Learned was if I just did a laminectomy, if he already had a little bit of a slippage between the vertebrae, that probably over time that slippage would get worse and his symptoms would come back. So I felt that he needed a fusion along with the decompression. We talked about the bigger operation, the putting the screws in, but I think in his case it was a better option to do something a little bit less that would allow a faster recovery. So we ended up doing the eye lift procedure, and this is an X-ray showing the spinous process plate, and this is the bone graft, and this is a side view, a lateral X-ray. That's an AP X-ray over there. Okay, next. So how is Mr. Mitchell doing? I think maybe we ought to let him tell you. And he's here today. I'd like to, at this time, introduce Mr. William Mitchell. All right. Turn it over to you. I'll give you a hug.
Give me a hug. Can you see the plate? No. About a year ago, we went to see Dr. Mills. I was really having problems. I was actually walking like this, literally, and my wife will tell you. Now, I'm back to about 99% normal, as you can see. No problems whatsoever. Can go back and forth across. We can do, okay? We can walk like this. We can stretch. We can do just about everything I want. No problems. Went to therapy from, you had me down, what, about 6-7 weeks? April, May, about second week in June, I started therapy. We first started on the core. That was the biggest thing. We got the strength up there. The only problem I had afterwards was I had some nerve pain. Called Dr. Mills, he called me back personally. Told me he was going to give me something. He did. That was it. After the surgery, minimal pain. The only thing it was sore. It was sore, but that was about it. Therapy went on all summer. I was discharged right before the new year. And was going 3 times a week. We did everything. I showed up. And the only thing I can tell you is he can put anything in your back or your leg or something. That's fine. But you're not going to walk out of the hospital cured. Most of it is up to you. You have to decide what you want to do, how well you want to be after the surgery. Okay? It's up to you. 99% of that is up to you. If you feel you don't want to walk like me right now, then you don't go to therapy and you don't exercise at home. But I exercise at home now 5 days a week on the treadmill, back up to 1.25 miles a day, okay? Doing what I have to do. I can do all my stuff around the house, no problems. He doesn't know, and this is the first time he's going to find out. About a month after the surgery, I was putting up a ceiling fan, okay? So that just goes to show what I went from April while I was doing my therapy, and I got HE double hockey sticks from my wife and my kids, but I was able to do it with no pain. I'm working out at home 5 days a week by myself, and it's really making a difference. The procedure, I went in on Friday morning, and I was home Saturday night. I can't tell you how good it is to do what I did right here, and, you know, basically not back to where I was or will ever be strength-wise and everything like that, but it's to where I can do everything I want to do now. So I don't know what else I can say. Is my experience has been great. I was able to walk my daughter in October to her wedding straight down the aisle, no flopping, no off balance, could walk down the aisle straight. That was the biggest thing.
That's, in my eyes, that's the definition of positive energy. I'm a big believer in positive energy and negative energy, and he's got positive energy. You have to have that too. Anytime you go through an operation like this, you have to have the right mental outlook about it. You have to be willing to put some effort into it and participate in your recovery. I really appreciate all my patients. I appreciate the way you've done. It really gives me a good feeling when I see somebody get a really good result like Mr. Mitchell. But that's why I emphasize to my patients. Many of you probably know that I'm fairly regimented sometimes in what I do, and I do feel strongly that before you have an operation on your spine, you should quit smoking. I know a lot of people don't like that, and they feel that that's not appropriate, but it really does make a difference. It makes a huge difference in the type of outcome that you get. So I tend to be fairly unbending about that if you're a smoker, you really have to quit smoking before I'll consider doing one of these procedures. Also, it is very important to exercise, to maintain a healthy lifestyle, and you really do have to participate afterwards as far as the physical therapy goes, the commitment to doing daily core strengthening exercises is as important, I think, as the operation, maybe more important, probably more important.